In this recording, I'm going to go through a whistle-stop tour of the best website homepage. Right, we've already said that's all you've got to put down to log into the page, and you can be home, work, anywhere. This is the search box. Here you can put in something like menopause, tinnitus, whatever it is to search, but we'll look at that in detail later. That's your login, as if you want to use it for favorites or CPD. Now at the top here, you've got a few top tabs, I'd call them. So contact numbers, diagnostic tools, prescribing guidelines, patient information sheets, investigation, referral, and useful website. In here, I've put content that I am likely to use on an everyday basis that I need at the tip of my fingertip when I'm consulting with my patients. So for example, if I click on contact numbers, right, here are hospital numbers when I need to admit someone. If you scroll down, there's a few more at the bottom. Community nursing service, self-referral numbers, mental health numbers, safeguarding, and then there's other things like coroner's officer, IT, etc. So if you just click diagnostic tools, Bristol stool score, alcohol units, things to do with diabetes, height, weight, and what I've done, I've divided them into clinical sections. Again, so just scroll down to see the others. You've got abnormal LFTs, etc., AKI, CKD. Right, prescribing guidelines, one of the most popular ones are antibiotic guidelines, vitamin D, and COPD, and preemptive drugs, but I'll let you have a look at that in detail, and we'll talk about that later. Patient information sheets, home blood pressure monitoring charts, x-ray information, phlebotomy information, workshops, diaries, sound video library, diet sheets, exercise sheets, and a few general things. Investigation referrals are stuff like DNA CPR forms you might need, any other mental health referral forms, etc. Something that's really important here is first port of call, local pathways. We'll look at that later on. And in terms of useful websites, just a few, for example, BMJ e-learning modules, Dietetic Association, they use DVLA, Peace Primary Care Dermatology Society is very popular, Live Well Barnsley, and patient information sheets. Right, so these are, as I say, commonly used content. Then here are the other top tabs. So home, this is, every time you press home, you literally get to this home page. Best events, that's where all the talks that have been recorded from the best events, all the way down from 2014, they're all on. Alternate months now, because we have locality meetings, I'm planning to put other useful information and other e-learning modules on. Education and events, under here you'll find a link to the best talks, an events calendar which has clinical, non-clinical meetings, as well as, for example, GP update meetings, BMJ meetings, etc., IT training, and this is one of your links to the BMJ e-learning modules with some information how to get to them. Relaxation, I think I'll let you find that out on your own. Medicines, so this is one of the sections that medicine management has. You will find other medicine management areas which I will talk about, and here, update section. I've just recently done this where every week over the next 3 months or so, I'm going to let you know the content that I've been adding on over the last year onto the website that you might not be aware of. Let me just press the home page. Okay, so we've done that. We've done the top tabs, we've done the top tabs. Now let's look at this. This is the main body of the website where the main clinical content is. Now if you have a look, it's put in a systematic way where you start from the top head end, brain, mental health, then you've got eyes and ears, then you've got your lungs, heart in between. This is, I guess, pancreas lower down. I know thyroid gland is a bit higher up, but hey. This is the guts and hepatologies here, renal, men's health, lower down women and sexual health, pediatrics. We need our bones and our skin. This is a few extra things I thought were important, and laboratory investigation, infections. And look what happens when I press on brain and mental health. Things that I think are related, You just have to click to get there. Same with ophthalmology, ENT, same with respiratory, smoking, cardiovascular, lipids. Let me do this one. Okay, renal, urology, mental health, women's sexual health. There's quite a few options there. Pediatrics hasn't, cancer palliative care, and don't forget this section here, general. We'll come to that later. And for example, if I go back onto brain and mental health, press neurology, then things related to neurology. Here we'll have any anatomy pictures related to neurology. After that, any diagnostic tools that we may need for neurological conditions. Then any local pathways, for example, headaches, TIAs, etc., that are relevant to Barnsley. Then any national guidelines, any medicines information in terms of neurological conditions, the prescribing, shared care or drug monitoring. If we need to refer somebody for any neurological conditions, what are the criteria? Do we need any special forms? Then any services related to neurology, and any patient information sheets I might want to give on headaches, migraines, etc. And then any useful websites either for the patient or for us as professionals. If I just close that, and what you'll see, I'll just press it again, it should go. Right, and if we go lower down, so this is, I guess, the anatomy of a consultation. As we just mentioned, we first look at what part of the body, what diagnostic tool to diagnose a problem. We follow a local pathway or guideline. We may want to compare it to a national one, national guideline. Then what medicines we may want to give. We refer patients, services, giving out leaflets, and then useful websites we want to know about. I've pressed it again too hard. Right, anyway, here is where we normally have a poster for the next best meeting. Here we like to put down any newsletters. So for example, any screening and immunisation, you'll see the medicine management letters here. Normally APC newsletters will be here as well, but any other relevant info released by the CCG will be here. Here we'll have any upcoming meetings. As I've said, it can be clinical meetings, it can be non-clinical meetings. So that's the, one of the dermatology meetings. We'll have GP update meetings, etc. there. Right. Going lower down, we've got 6 boxes, right? So this box is also to do with medicine management. This is a box where I wanted other healthcare professionals that we use as GPs to have a platform. So it's all to do with bringing people together. So here is a section for the Barnsley pharmacist. This takes you to the Barnsley Hospital website with more detail about their services. This is about the Swift services. They're recently having a slight uphaul and rearrangements, etc. So things might change a little. Social care, wellbeing, public health and housing website. Commissioning box. I guess this is a very important box. So we're putting the PD, individual funding requests, safeguarding pages, things to do with capacity, prevent, incident reporting, CQC, infection. Now in this box, working in appraisal, any of these you might need. However, I think there's some really important content I've recently put into this top link, which will give you blank documents to use when you're doing your appraisal. Practice nurses, this has been put on over the last 6 months. All different kinds of resources and educational material that nurses might need, and if you link on each one, this one will take you to heart sounds and lung sounds and other e-learning modules, etc. Right, now this again I've produced in the last 6 months. This care navigation first part of call. I'm sure all practices will find this beneficial. You like this to locality specific baseline data. These are services that are locality focused, so all the specialist nurses for each locality, etc., and which clinics, which care homes, and each link will then take you to another page. Okay, so that is a quick whistle stop tour of the homepage of the Barnsley Best website.